What if I told you that in the glorious 1940s, the cutting-edge cure for feeling a little unstable wasn't therapy or fancy pills? Nope, it was an ice pick and a common workshop hammer. And the best part? A doctor would literally jab that ice pick through your eye socket, tap, tap, tap it through the bone, wiggle it around, and voila, you were cured. This wasn't a back alley horror movie. This was state-of-the-art medicine, and the man who perfected it, Dr. Walter Freeman, was nominated for a Nobel Prize. This is the insane, chilling, and utterly bizarre story of the lobotomy. Now, before we paint these guys as complete monsters, we have to understand the context. The early 20th century was a terrible time to have a mental illness. If you were severely ill, you were sent to an asylum. And asylums were not hospitals. They were human warehouses. Overcrowded, filthy, desperate places where patients were often shackled, hosed down with ice water, or simply left to rot. The treatments were creative. A popular one was hydrotherapy, which just meant mummifying a patient in ice-cold wet sheets for days. Or they might spin you in a centrifugal chair until you passed out. Doctors would even pull out all of your teeth and tonsils, believing some hidden infection was the root cause of your sadness. In fact, one of the only treatments that actually won a Nobel Prize before this was to intentionally infect schizophrenic patients with malaria. Yes, give them a raging, life-threatening fever, hoping the shock would reboot their brain. This was the world they lived in. It wasn't medicine. It was desperation. They weren't looking for a good cure. They were looking for any cure. And then, one appeared. His name was Egas Moniz, a Portuguese physician. In 1935, Moniz attended a medical conference in London. He sat through a presentation about two chimpanzees named Becky and Lucy. Becky and Lucy were a handful, aggressive, prone to fits. But after a scientist surgically removed their frontal lobes, they became incredibly calm, docile. The presenter noted they no longer seemed to get frustrated. A light bulb went off in Moniz's head. Humans get frustrated. What if? Just weeks later, he tried it. His first patient was a 63-year-old woman. Moniz drilled 2 crude holes in the top of her skull, injected pure alcohol into her frontal lobe, and chemically burned away the connections. He called it a lobotomy. The result? The patient's anxiety did seem to vanish. Of course, so did her personality, her interests, and her general spark for life. But hey, she wasn't anxious. The medical world, desperate for anything, went nuts. They thought this was it, the cure. In 1949, Egas Moniz won the Nobel Prize for this procedure. Remember that. But Moniz's method had problems. It was messy. It required drilling holes in the skull. It needed a real surgeon and an operating room. It just wasn't efficient. And that's where our main character storms onto the stage, Dr. Walter Freeman. Freeman was an American neurologist. And he wasn't just a doctor. He was an evangelist, a showman. He was a brilliant, arrogant, and relentlessly driven man who believed he was on a holy mission. He saw Moniz's procedure and thought, I can do this better, faster, cheaper. I can bring brain surgery to the masses. His first patient was a housewife from Kansas named Ellen Ionesco. She was agitated and suicidal. Freeman and his partner, James Watts, drilled the holes in her skull, the proper Moniz way. Afterwards, she seemed calm, but also different, blurry. Freeman, however, declared it a stunning success. He was hooked, but the skull drilling was slow. It bothered him. He needed an assembly line. He tinkered in the morgue. He practiced on grapefruits. He was looking for a shortcut to the brain, and he found one. He realized the fastest way in wasn't through the thick skull, but through the paper-thin bone at the back of the eye socket. He just needed the right tool. He went to his kitchen. A fork? No. A knife? Too wide. And then he saw it. The ice pick. It was perfect. He ordered a custom-made, stronger version called an orbitoclast. But let's be real, it was a fancy ice pick. His new transorbital lobotomy, which he perfected in 1946, was a masterpiece of horrific efficiency. Step 1. Get the patient relaxed. How? By strapping electrodes to their head and electroshocking them into unconsciousness. Step 2. Lift the patient's eyelid. Insert the ice pick into the corner of the eye socket, right above the eyeball. Step 3. Take a small hammer. Give the ice pick a few firm taps. Tap, tap, tap. Step 4. You'd hear a sickening pop as it broke through the bone. He'd push it in about 2 inches. Step 5. The part where you squirm. He would then violently swish the ice pick back and forth, like a windshield wiper, severing the frontal lobe connections. Step 6. Pull it out. Do the exact same thing on the other eye. The whole thing? Less than 10 minutes. He charged $25 a pop. Walter Freeman became a medical rock star. He bought a custom van, which he proudly called the Lobotomobile. He would drive this Lobotomobile across America on a one-man lobotomy tour. He'd arrive at a state hospital, and the staff would have patients lined up, sometimes dozens at a time, and he was a performer. He'd operate in front of packed auditoriums. He was sloppy. He didn't wash his hands between patients. He didn't wear gloves. There's a famous story where, during a demonstration, the ice pick broke and got stuck in a patient's brain. Freeman just shrugged, calmly got a new one from his toolkit, and started on the other eye while everyone else in the room tried not to vomit. His favorite party trick? The double-handed lobotomy. He'd take an ice pick in each hand and operate on 2 patients at the same time. 1 pick for the left, 1 for the right, like a horrific piano player. He once lobotomized 25 patients in a single day. He was fast, he was flashy, and the media loved him. Magazines called it a miracle cure. The lobotomy seeped into pop culture. It was seen as a quick fix for difficult people, especially women. In plays like Tennessee Williams's Suddenly Last Summer, the threat of a lobotomy is used to silence a woman who knows a dark secret. It became a cultural symbol of conformity, a way to tame the rebellious. But for the vast, vast majority of the 50,000 Americans who received one, it was a tragedy. Freeman's cure didn't fix the illness. It just deleted the person. Patients lost their personality, their memories, their ability to think, to plan, to feel joy or sorrow. They became empty, docile shells. Freeman himself chillingly described the ideal outcome as a surgically induced childhood. He turned people into household pets. And the most famous victim was Rosemary Kennedy. She was the sister of future President John F. Kennedy. Rosemary wasn't insane. She was just difficult. She had learning disabilities. She was moody and prone to emotional outbursts. Her father, Joe Kennedy, was a political patriarch obsessed with his family's image. He was terrified that Rosemary's episodes would embarrass the family and ruin the political careers of her brothers. So, in 1941, at the age of 23, he secretly had Walter Freeman perform a lobotomy on his own daughter. During the procedure, Freeman had Rosemary, who was awake, recite prayers. He kept cutting until she became incoherent, and then silent. The result was catastrophic. Rosemary went from a vibrant, difficult young woman to an infant. Her intellect was reduced to that of a 2-year-old. She couldn't walk. She couldn't speak. She was incontinent. The Kennedy family erased her. They told the public she was reclusive and hid her away in a private institution for the rest of her life. Her own siblings didn't even know where she was for 20 years. Freeman's downfall was as swift as his rise. But it wasn't Rosemary's story that did it that was kept secret. It was a pill. In 1954, a new drug called Thorazine was introduced. It was the first effective antipsychotic medication. Suddenly, doctors had a way to calm agitated patients without turning them into vegetables. The medical community, no longer desperate, finally woke up and looked at what Freeman had been doing. They saw the fields of zombie-like patients he had left in his wake. It wasn't a cure. It was butchery. His own partner, James Watts, had abandoned him years earlier, horrified that Freeman had turned their delicate brain surgery into a 10-minute ice pick routine. But Freeman, he never stopped believing. He was a man who simply could not admit he was wrong. His career only ended, finally, in 1967. A patient named Rebecca Doolittle died on his operating table. It was her 3rd lobotomy, performed by Freeman. Only then was his medical license finally revoked. So what's the final tally? Freeman personally lobotomized nearly 3,500 people, including 19 children, one as young as 12. His mentor, Egas Moniz, kept his Nobel Prize. To this day, the Nobel Committee has never revoked it, and it remains one of the most controversial, blood-stained awards in history. The lobotomy is now a terrifying reminder that the road to hell is often paved with good intentions, and that in medicine, the line between pioneer and madman can be as thin as an ice pick. So, next time you're feeling a bit stressed, be glad we live in an age where a nice cup of tea is always a better option. Thanks for watching.